welcome. Good morning, everybody. Thank you all for joining us today. We're very excited. I am Linda Gang. I am an internist and co-director of the Stanford Long COVID Collaborative, along with Dr. Hector Bonilla. We're really excited to be hosting this webinar series called Unraveling Long COVID, Advances in Clinical Practice. Today from 9 a.m. to 1 p.m. It'll be a half-day webinar conference featuring a lot of different speakers from multidisciplinary expertise in different specialties. We're really excited of clinicians who've seen patients with long COVID. We're really hoping to share some of the knowledge and expertise about diagnosis, recognition, and care for patients with long COVID today. As folks are rolling in, I just wanted to do some introductions about what the day will look like and how to claim credit and our goals and objectives for this webinar. So thank you all again. So I just wanted to introduce that this educational activity is part of a larger initiative as part of our Stanford Long COVID Collaborative. We have a program called Long COVID Care Reach, Resources and Education to Advance Community Health. This is done in partnership with San Mateo Medical Center, as well as Community Health Center Network, as well as other stakeholders in the community, including public health departments, community-based organizations, and other stakeholders as well. The goal of our program and initiative is to improve and expand the care for patients with long COVID, especially across the community, especially for vulnerable communities. We're really excited to have this be a kickoff webinar event that helps provide the resources and education to help support our community clinicians and colleagues to be able to recognize, diagnose, and have better tools for the care of patients with long COVID. This educational webinar and the Long COVID Care Reach initiative is supported by the Stanford Department of Medicine Team Science Initiative, as well as the Agency for Healthcare Research and Quality. ARC has a long COVID care network, of which Stanford, as well as multiple other institutions around the country, are part of, as a national effort to improve care and comprehensive access for patients with long COVID. The objectives of our webinar today include identifying the spectrum of symptoms associated with long COVID across various organ systems, enabling an accurate recognition and diagnosis in clinical practice, as well as applying a diagnostic framework and tools to both differentiate as well as recognize overlap in long COVID with other chronic conditions with similar presentations. And finally, also to think about and develop patient-centered strategies for long COVID management, as well as thinking about when to refer to specialists and specialties. This is our accreditation statement. The full accreditation information, as well as faculty disclosures, will be on the course website. And you can claim this activity for the full half day is certified for up to 3.5 credits that you can claim. And make sure you do fill out your survey after the activity. And this is further information. Please feel free to go to this website if you'd like to look into this further. For the program today, we're really excited. I'll do introductions for the speakers as we go along the day, but I just wanted to give you an overview of what we're going to be talking about. And there's so much to cover for the field that's very rapidly growing about the care of patients with long COVID. And this is just the beginning. We're hoping to have actually another webinar in the future and love to have your feedback as well about how, the content for today and the delivery to help you have the tools that you need when you are taking care of somebody with long COVID. We're going to think about the diagnosis, the epidemiology, and the equity of long COVID care from Dr. Levy. We're going to think about an overlap syndrome called MECFS, chronic fatigue syndrome with Dr. Bonilla, think about autonomic neurological symptoms, as well as cardiac manifestations from Dr. Miglis and Dr. Yang. And Dr. Crystal will be, is an OBGYN who will be actually moderating a lot of the question and answer sessions. We'll also have a special feature and a special guest from Joshua Roman, who is a world-renowned cellist and has personal lived experience to share with you all. So you can hear from the patient perspective directly. We'll take a break halfway through, and then we'll go to our session 2, featuring topics such as vaccines and reinfection in long COVID with Dr. Schaefer, pulmonary conditions and management in long COVID with Dr. Eggert, and then as well as our sleep experts, Dr. Sumping and Dr. Simpson, who will talk about the different facets of sleep issues in long COVID. And then finally, also wrapping up with a session 2 Q&A and adjourning the today's webinar. So before we get started, I do want to just poll the audience. So if you would kindly answer these 3 questions. Long COVID as a novel condition that arose during the pandemic, there's still so much that is dynamic in terms of its understanding, in terms of still understanding the prevalence, and then how to recognize, diagnose, and treat. So part of our webinar goal is to help provide resources and provide education, but we would love to be able to understand what are your thoughts and understanding and perspectives. So number one, how serious of a problem do you think long COVID is in your patient population and practice setting, understanding that we all come from a lot of different are taking care of a lot of different patient populations in practice settings that are very diverse, as well as how do you feel in your confidence in recognizing and diagnosing long COVID? And how familiar are you with the current treatment and management options for long COVID? Thank you so much for answering this. And I'll give folks just a couple minutes to look through the questions and answer. And we'll share the answers very shortly as well. Okay, we'll give folks just a couple more moments and then we can display the audience poll results for these questions. All right. Thank you all for answering. And you should be able to see a pop-up that shows the intro poll questions. So we have a spread of some of the answers to these as expected. And the majority of people think that this is somewhat of a serious problem for their patient population or practice setting, but a diverse kind of answer set as well. And also uncertain. And I think that's a really important question as we're trying to understand what is the true prevalence and what are people going through and how can we best care for them. And majority of people said somewhat confident for your ability to recognize and diagnose, as well as somewhat familiar or not familiar at all in terms of long COVID management options being the most popular answers, and some who are very familiar. So that's great. And please feel free to, as we go through the webinar, if you have questions or thoughts, feel free to put them in the Q&A. Great. So now I will turn it over. And our first speaker today, let me just unshare my screen so we can let Dr. Levy start. And we're going to post this all up. So as we go through the session today, we'll hear from each speaker. And as a reminder, you can feel free to input your questions as they come to your mind in the Q&A. Dr. Ruthie Crystal will be moderating the questions. And then once we have finished one session, we will then do the live Q&A sessions with our speakers based on your questions. You can also feel free, if you see questions that you also want to hear answered, feel free to upvote those questions and they're more likely to be answered as well. And we'll do our best to try to get to as many questions as we can. And we'll also try to share resources after the webinar. This webinar will be recorded and made archived and available on demand viewing at a later time as well. Okay, great. So I wanted to introduce Dr. Vivian Levy, who is Chief of Infectious Diseases at San Mateo Medical Center and also our site principal investigator for the Long COVID Care REACH initiative. So we're really excited. Dr. Levy is going to be talking about the challenges in the diagnosis and equity of long COVID care.